Welcome to End of Life University on YouTube. Today I'm sharing with you an audio only solo episode that I recorded on the difference between hospice and palliative care. So this is an educational video meant to help people out who are not really sure what palliative care is or what hospice is, and it will walk you through both of those and explain the differences to you, which is something important for all of us to know. So don't forget to subscribe to this channel down below. Also subscribe or follow the podcast wherever you happen to listen and leave a rating and review. Also, if you're willing to chip in a little bit financially to help keep the show on the air, go to eoluniversity.com/support and you'll find out 3 different ways that you can help out financially. So thanks in advance for that. And we'll get on now with my solo episode on hospice and palliative care. Hello, and welcome to End of Life University podcast, where we share real talk about life and death. I'm your host, as always, Dr. Karen Wyatt, and thank you for joining me here for episode number 221. Today is a solo episode, and in just a few minutes, I'll be talking about the difference between hospice and palliative care. And I realize for some of you, this is a no-brainer. Some of you already work in this industry and you know full well the difference between hospice and palliative care, but there might also be listeners out there who aren't sure they know the difference or wouldn't know how to tell someone else what is different about hospice versus palliative care. So I thought this would be something good to review, especially because I do interviews all the time with people who work in hospice or in palliative care. And for those of you who may think that you understand the difference, maybe this is a good review. And maybe if someone asks you a question, you'll have a little easier time answering the question about the differences between the 2 types of care in the future. I'm hoping to do a few more of these explainer type episodes as we go along to make sure that all of us have a common basis of knowledge about the things we're talking about here around the end of life. So rather than assume that everyone knows this information, I thought it'd be nice to put some of it out there. So this is kind of an end of life 101 series in a way that I'll be offering from time to time, just some basic information about both hospice and palliative care. So before I get into that, I do want to mention that we have now officially crossed the milestone of 100 patrons on my Patreon account. And so I just produced the first end-of-life news update for patrons only, and it was really fun. I went through read a lot of articles and studies that are going on right now, and posted those and had a little chat about those for everyone. So that's out there and available on the Patreon page right now for anyone who's a supporter. And then before long, I will be from time to time also creating movie reviews. My husband and I are going to do those together, and we're going to review movies that deal with grief or end of life issues that we find just on streaming services like Netflix, Amazon Prime, HBO, Hulu, whatever we find out there. Sometimes we come across obscure movies that you may never have heard about that are actually amazing and wonderful. So we thought we'd do some reviews, share our thoughts and opinions on those movies, and maybe you'll discover something new that you might enjoy watching as well. So that'll be coming up probably we'll do our first one within the next couple of weeks. Again, that's for Patreon supporters only. And so supporters at any level on Patreon can get access to those. Today, I'd like to thank my newest supporters on Patreon, Lisa Monroe, Deb Pazdurka, and Debbie Hinkmeyer. And also to let you know, another supporter, Molly Bayak, who also made a donation to the page. If you don't want to be part of the Patreon experience, you can also just make one-time donations to End of Life University by going to my webpage, EOLuniversity.com, and at the very bottom of the homepage, you have to scroll all the way down. There's a donate button there, and you can just make a one-time donation if you're interested in doing that. all of it's appreciated very much. And if you'd like to be on the team at Patreon and get some of the Patreon bonuses, you can go to patreon.com/EOLU. All right, so now I'll move into my content, and I hope this isn't too simplistic for most of you to listen to, but it is really important. I constantly meet people who have misconceptions about hospice or palliative care, don't really know what either one of those means or why they would choose one over the other. I'm going to start with palliative care first, because palliative care is more of an umbrella sort of term that actually can include hospice care as well. So I'll start by telling you what palliative care means. Palliative care, it's a type of specialized medical care that people can receive at any age of life who are dealing with a serious illness. The palliative care that is being offered now most frequently occurs in hospitals. So if a patient is in the hospital getting treatment for some sort of a serious illness, they could receive care from the palliative care team within that hospital, in addition to the other doctors that are already providing their medical treatment. Palliative care describes a type of care that is focused on comfort, quality of life, and relief of symptoms such as pain, anxiety, or depression, but also just helping people have greater well-being while they're going through this experience of treatment for an illness. The illness does not have to be life-threatening for a person to qualify for palliative care. You can receive palliative care by being referred by your treating physician who asks for a consultation or sends a referral out to the palliative care team. It's important to know that not every hospital or community has palliative care available because it's somewhat newer on the scene. There are many hospitals offering programs and beginning to develop programs in palliative care, but you may not have a palliative care provider available in your community or in the hospital you choose to go to. So that's something you might want to do research about. What is special about palliative care is that it is care provided through a team of people, not just one provider. The team ideally consists of a doctor or perhaps a nurse practitioner who has been trained in symptom relief and comfort care for patients, but also a chaplain, social worker, and a nurse. So this team comes together, meets with a patient and family when they've been consulted to decide what they can do to help provide more comfort for the patient and also the family members, to help with symptom relief such as pain relief or relief of other symptoms that are taking place as a result of the illness the patient has or the treatment the patient is receiving. Now, the treating physician, say for example, the patient has cancer, the oncologist is in charge of treating the cancer, and oncologists themselves do provide pain medications and do try to help patients with their symptoms. So it's not that a patient who doesn't get palliative care won't have any relief for their symptoms, but the oncologist's specialty and expertise is in treating the disease. They also offer help with symptoms, but the palliative care team has specialty training in relieving symptoms, and therefore the palliative care team is more experienced, has a dedicated focus to working on symptoms. They're not talking about how to cure your disease or working on treatment, only on how can we help you have more quality of life and have a better experience as you're going through this illness. So to receive palliative care, as I said before, you do not have to have a terminal diagnosis. You could have a diagnosis like cancer that could potentially become terminal at some time in the future, but at the point you're at right now, no one knows if it will be terminal or not. And so you can be in the middle of treatment and receive palliative care, which can help you have a better course and more well-being and greater comfort as you're receiving treatment. So palliative care happens side by side, right along with the curative treatment you're undergoing. As I mentioned, most palliative care programs are offered in hospitals. That's where palliative care really got its start. But there are also now outpatient palliative care programs where you can receive palliative care during clinic visits, some palliative care programs that make home visits to patients as well. The palliative care team may differ from hospital to hospital. And so while the ideal team I mentioned has those 4 members, physician or nurse practitioner, nurse, social worker, chaplain, not every palliative care program in every facility may offer all of those simply because some programs are newer and just getting started. And so the way a palliative care program begins is that they may hire one person, like say a palliative nurse practitioner, who is hired to develop the palliative care program. So that person may come into the hospital and begin creating educational programs for other physicians and for the staff of the hospital to learn about palliative care, so they can learn who and when they should refer to the palliative care specialist. But in the beginning, there may not be enough demand for palliative care until the hospital staff is educated about how to utilize palliative care and what benefits it offers. So some programs that are just getting started may not have a full dedicated team who does just palliative care. But as I was mentioning, a program like that, a couple that I've worked with, have begun by hiring a nurse practitioner, a palliative specialist nurse practitioner, to create the program for them. Then they utilize the hospital's chaplain who already works for the hospital and social worker and nurses that already work for the hospital in other areas to fill in the roles of the team. Ultimately, as palliative care programs grow and become bigger and with a greater patient census and are being utilized regularly in the hospital, then a hospital may have one dedicated team of those 4 people I mentioned before, those 4 roles I mentioned, who only see palliative care patients. That's very possible. There may also be other iterations in outpatient clinics and also for home visits. So I don't want to imply that a palliative care team or the palliative care that's being offered always looks the same. It could differ a great deal from one hospital to another or one community to another. If palliative care is something that you're interested in for yourself or for a loved one, it's important for you to do a little research and do your homework. Check with all the hospitals in your area, find out what they offer. So the great advantage of palliative care that you really should know about is that while in Western medicine we've made great strides in treating serious illness, and the curative treatments that we have can be amazing and miraculous sometimes for people, they can also be tedious and exhausting sometimes. The treatment regimens that people have to go through and the symptoms and side effects that they occur in the process of being treated for their illness. Palliative care is important because there is an entire team of people who are focused only on how do we support you and assist you as you're going through this challenging curative treatment for your illness. How do we help you on this journey? What can we do to make everything better for you? Maybe we fine-tune your pain management so that you have less pain. Maybe we help you with nausea, or we offer you some suggestions and ideas that help you have more energy. Maybe we even help with your relationships in your family to help other people in your family get on board and know how they can be more supportive of you and how they can come together themselves to help you in the best way possible as you're going through this treatment. And once again, the illness does not have to be terminal or be at a place where a decision has been made that it's terminal, and you can continue all of the same curative treatment that you have been receiving in the past. There's no change in the treatment that you're receiving. Palliative care is added on in addition to the care that you are already receiving. And palliative care focuses on the whole person, not just the physical treatment, but also emotional, mental, and spiritual treatment and well-being of the patient. So palliative care fills in some of the gaps that may have been there in the process of curative care. And patients feel supported, they feel whole, they feel more energized, more positive to come to terms with their illness and to make decisions for their future when they have the support of a palliative care team, patients and their families as well. So once again, to receive palliative care, you usually need to have a referral from your treating physician, whether it's in a hospital or in a clinic. And so another place to do homework is to make sure that your doctor knows what palliative care is, knows how to access palliative care if you decide that you would like to have that. From my perspective, there are no real reasons not to have a palliative care consult. If you're going through treatment for a serious illness, why not? Why not have palliative care available? Because you never know how much it could benefit you or a loved one and the family members as well who are surrounding that person. Palliative care really represents the best care we have available to us right now because of that whole person approach and the fact that it's being offered by a team of people who bring their expertise together to do the best for you. So again, if you don't know right now if palliative care is even available in your community, it might be a good question to ask. Also, because the more people who start asking hospitals whether or not they have a palliative care program, the more those hospitals might be motivated to create such a program. So I think it's worthwhile to look around, investigate what's available, even if you have no need of it and no idea when you could possibly want to consult a palliative care team in the future. It's good to find out right now what's available because you might be able to influence the future in your community and help bring a program to your community that doesn't exist right now just by asking questions and just by encouraging people in the healthcare community to think about the importance of palliative care. So that covers the basics of what palliative care is. After I describe hospice care, I'll be talking about the differences between them because there's some very significant ones that you need to know about. So just to reiterate, as I get started talking about hospice care, I mentioned that palliative care is for any patient of any age with a serious illness. It does not have to have a terminal prognosis, and you can be receiving curative treatment and receive palliative care at the same time. Hospice care is in some ways a similar type of care, but hospice care is specifically for people who are terminal, who are at the end of life, and who in fact specifically have been given a prognosis of 6 months or less to live. So the illness has to be described as terminal by the patient's doctor, and the doctor has to certify that the doctor believes the patient has 6 months or less to live in order for the patient to qualify for hospice care. So right there, you've already noticed one difference from palliative care, that the patient must be terminal and within 6 months of the end of life, even though patients who live longer than 6 months continue to receive hospice care. They just get recertified and can continue to receive care because it's very hard for anyone to know an exact time frame for the end of life. To receive hospice care, you also have to have decided to no longer receive curative treatment. So this is where hospice diverges greatly from palliative care. You have to have made a decision to stop curative treatment, usually because the doctor states that it's not working and there's no longer a reason to continue curative treatment. So when a patient decides they've had enough of treatment, they're ready to discontinue it. And when the doctor certifies that they are within 6 months of the end of life, that patient is then qualified to receive hospice care. Similarly to palliative care, hospice care is provided by a team of people. There's a doctor, nurse, home health aide, social worker, chaplain, volunteer, this entire team of people who help patients as they negotiate symptoms and issues that arise at the end of life. Hospice care is most often provided in the patient's home or wherever the patient resides. If the patient happens to live in an assisted living facility or a nursing home, hospice care is provided in those places of residence as well. And there are also inpatient hospices where patients who need much more acute care can be taken care of as well. Hospice care, like palliative care, is focused on quality of life and symptom management and comfort for the patient and for the entire family. So the entire hospice team is focused on helping patients find peace of mind and as much physical, emotional, mental, and spiritual comfort as is possible at the very end of life. All of them have received specialized training in helping patients and their family through this difficult and challenging period. So, like palliative care, hospice care provided by a team and focused on the needs of the whole patient, not just a diagnosis. And in fact, regardless of the diagnosis, the focus is still the same for hospice workers to help each individual patient and their family with whatever their needs are as they approach the end of life. So the care provided in palliative care and hospice care is very similar. It's focused on comfort, well-being, peace, quality of life. But there are some significant differences. I mentioned a couple already. One, that the illness must be terminal to be in hospice and with a diagnosis of 6 months or less. And there can be no more curative treatment once the patient enters into hospice. So if you think about the continuum of an illness, and we could use cancer as an example, early on in the course of a cancer diagnosis, any patient is qualified for palliative care while they're receiving treatment. They can receive treatment for any length of time and also receive palliative care, which will help them with symptoms they're having either from the illness or from the treatment that they're receiving. If at some point the doctor decides and the treatment team decides that treatment is no longer working, and if the doctor and the patient and family members together decide that it's not worthwhile to continue treatment, and also if the doctor decides we are now within 6 months of the end of life, that patient may elect to move into hospice care instead of palliative care. The hospice care will be similar in that it's provided by a team focused on the needs of the whole person and also focused on quality of life and comfort, but it's provided primarily in the patient's place of residence, which is one thing that's very nice for the patient. And there are some other differences as well because of the way hospice is paid for, which I'll discuss more about in a few moments. Hospice, once you elect that benefit and decide to turn away from treatment and turn toward hospice care, hospice pays for all of your medications related to the terminal illness, any medical equipment needed, like a hospital bed, bedside commode, wheelchair, any other types of equipment that might be needed, and also covers all of the care that you receive from the providers. So there are additional benefits that a hospice patient receives that were not covered under palliative care. And part of that is because once a patient goes on hospice, they're usually sicker and have greater needs for support and care. So hospice covers more of those needs than palliative care, might have covered early on in the course of the illness, but the patient has greater needs at this point, at the time when the patient is entering into hospice care. And I mentioned one very significant difference between palliative and hospice care is how these types of care are paid for. Palliative care is covered by Medicare and Medicaid and by some insurance plans. So you would really have to do your homework to find out if you have private insurance, if it covers palliative care. But it's possible that not all of the services provided by a palliative care team are covered by any one of those insurances, by Medicare, Medicaid, or your private insurance. So again, it's very important if you're receiving palliative care that you ask what services are being provided, what are the fees or copays, and find out what your particular coverage will pay for in palliative care. That's a very significant difference. Hospice care is covered fully by Medicare and by private insurance. And that's one reason why to receive hospice care, you have to decide to no longer receive curative care because of the hospice benefit provided by Medicare and also by insurances that does not want to double pay, be paying for curative treatment that it's already been determined is not going to be helpful, but also paying for all of the services for hospice at the end of life. So at this point in time, at least, hospice pays for medications, medical equipment, all of the visits that you need from a home health aide, from the doctor, the nurse, social worker, chaplain, any other supplies that you might need, like bandages. So once you go on hospice, essentially, your care is completely covered. Now, there are things that fall outside of the coverage of hospice. For one thing, hospice will pay for 1 week of respite care, which means if your family needs a break from providing care, you could be cared for in an inpatient facility for a week, and hospice will cover that in order to give the caregivers a break. But if you needed ongoing inpatient care, the hospice benefit would not cover the inpatient facility fee after that week if you needed to stay there for weeks or months, for example. So there could be other fees while receiving hospice care, but for the most part, the hospice benefit covers everything the average patient needs when they're receiving hospice care at home. So that's a huge advantage to hospice care and a reason for many people to decide to go on hospice care. Oftentimes, this is the question that comes up. If someone's already receiving palliative care, they wonder, why don't I just keep getting palliative care all the way through to the end of life? Why do I even bother with hospice? And it's because of that difference in the payment. Because since for palliative care, you may have some out-of-pocket expenses and you may be paying apart from what your insurance covers for palliative care. And if you were to shift into hospice care, you may find that a lot more of what you require, your medications, for example, supplies and equipment, are covered under the hospice benefit. So as we're talking about the financing, one thing important that a lot of people don't understand because it's very unique about hospice care, hospices are paid by Medicare and insurance companies on a per diem basis, which means per day. So they receive a set amount of funds each day for each patient who is on hospice. Then it's up to the hospice to provide what you need, the care you need, the medications, equipment, and supplies out of the daily funding that they receive from Medicare or your insurance. So it isn't that Medicare gets a bill for every single thing that you utilize. The hospice actually gets the bill, and the hospice receives just a set amount of money from Medicare on a daily basis to pay for what you need. So this is an interesting payment model that is fairly unique, as far as I know, to hospice. It can be problematic for some hospices because there are times when a patient's needs for care or supplies or medications or equipment in a single day far outstrip the daily amount that the hospice is being paid. So the hospice has to do a lot of juggling and balancing in order to provide everything the patient needs and stay within the limits of the per diem that they're receiving. Otherwise, they'll go out of business. So the hospice has to do a lot of managing and balancing of the funds that are available for caring for each patient. Another thing that is often a misconception about hospice care is that hospice care is not 24/7 care in the home. Some people have the idea that if they sign on with hospice, then there will be a caregiver provided by the hospice in the home with them every day. And that is not the case. So a patient on hospice must have their own caregiver, a family caregiver, or perhaps the family could hire a professional caregiver to be in the home with the patient. But the hospice does not provide 24/7 care. Some families have been shocked when they discovered that they were responsible for being with their loved one around the clock and providing the day-to-day needs of their loved one. And hospice is a support to that type of care, but does not provide the 24/7 care. So the home health aide may come in 3 days a week to help with bathing and dressing your loved one, also to teach you how to dress your loved one, how to change the sheets, how to give medications. They'll help teach you how to give the care your loved one needs, but it's up to family members one way or another to actually provide the care. So that's a shock to many people who sign up for hospice because they've always just imagined that it means that these loving, wonderful people will come in and just be there all day long offering care, and that is not how it works. So it's important to know that before you sign up for hospice care. But also keep in mind that per diem. And so the hospice continually runs up against the limits of how much is being paid on a day-to-day basis for each patient, and juggling and balancing to make sure the appropriate care can be provided within those limits. If nursing visits are needed every day in the last week or so of life, hospices will work to meet those needs. But earlier on in the course of illness, it's possible that nursing visits won't happen as frequently because they're not necessary. So I want to explain that because sometimes people feel that they should be getting more care than they are receiving. And some of that might just be a misunderstanding of what hospice is able to realistically provide. So to reiterate once more, palliative care is especially good for people who are not yet terminal, don't really know what the outcome of their illness and treatment is going to be, who would like extra support and comfort care and attention paid to their quality of life as they're going through treatment. And palliative care can be continued all the way through to the end of life. If a patient just wants to continue seeing that team, that's very possible because palliative care is equipped to provide comfort care all the way through to the end of life, but palliative care doesn't receive funding to provide other things like medications, equipment, and supplies that the patient might need. So hospice care is sometimes recommended, and the palliative care team will usually tell the patient and family now might be a good time to consider hospice because you can get more of the things that you need for this care at the very end of life. So I'm trying to make it seem simple when you might want to choose palliative care and when it may be more appropriate to consider hospice care. But one of the issues that is sometimes a stumbling block for patients in receiving hospice care is the fact that curative treatment has to be stopped before a patient goes on hospice. And I've met many patients who really did not feel ready to stop treatment, who felt that in order to give life their best shot and to do everything possible in favor of trying to live longer, that they needed to continue treatment. And some of those patients have rejected the idea of hospice because they didn't want to stop treatment under any conditions. They wanted to continue treatment. I do understand that. I understand that mentality, that especially because we have a lot of faith in our medical system, in our medical treatments available to us, and also faith sometimes in God, in miracles, in healing, and that people don't want to feel that they have given up and they're no longer even trying to face up to their disease. They're no longer trying to cure the disease or hoping for a cure or healing from their disease. And that going on to hospice would mean that they're just not trying. They've decided to just die and they've given up. I understand that it appears that way to patients who may decide they don't want to be on hospice because of that fact. They're afraid that it would feel to them like, I didn't try as hard as I could. I didn't do everything possible by taking every treatment available to me up until my last breath. And I can fully understand that mentality. But I also understand that some of the treatments that are available for illnesses are offered even when they're not very effective, when the chance of the treatment making a difference is very, very slim. But when the chance that the treatment will cause unpleasant side effects or complications is much greater than the chance that the medication will be helpful. In cases like that, I would want to educate the patient and family that it could be a better choice to stop the treatment so that you could maximize, again, the quality of life. You could stop having to go in for treatments that make you feel ill and that cause you discomfort and other unpleasant symptoms every day, so that you could focus on having quality of life and enjoying your time without the side effects from treatment. And at a certain point, if the possibility of treatment being helpful is very, very tiny, and the possibility of treatment causing negative symptoms is much greater, I would encourage people to stop and think about that. And actually, this is a case where a palliative care team can be very helpful in making these types of decisions. They can talk about what they've experienced and witnessed before and what it's like for patients when they make a choice to stop treatment and then go on hospice. And I think their guidance could be very useful. Again, it's perfectly fine if some people decide, no, I need to keep getting treatment. That's the right thing for me. In that case, definitely stay on palliative care. Definitely continue getting the quality of life care and symptom-focused care, comfort care that you could receive from a palliative care team to make sure that you have the best possible days you can have while you're continuing treatment up until the end of life. If, however, you decide that there are other things you'd like to do with your time than be in treatment and other things you'd like to focus on, it's possible that switching to hospice care and stopping treatment is the right thing. It's possible you can still get all the comfort care you need, all the quality of life support that you need through hospice, but be able to stop with treatments and any of the symptoms and side effects that they would be causing, so that you could focus your time and energy on being with your loved ones and maybe doing some things that you enjoy doing, pursuing a hobby or special interest during the last months of life. So what I'm trying to say here is that hospice care is probably not for everyone. It may not be the right choice for every person, and I understand and accept that. Palliative care, though, I would say palliative care it's a great choice. And for someone who's not certain about hospice care, or for whom hospice sounds very threatening, or worrisome, consider palliative care. Consider getting a palliative care consult and starting there. And along the way, along the course of an illness, as things change and as the prognosis becomes clearer, as you get more and more of a picture of how much time there might be left and of what the future holds, you might consider hospice down the road as something that there would come a time when you might want to choose to stop treatment and receive hospice care. I think it's important for you to understand that both of those types of care are available, and you can use both of them, and you can switch from palliative care to hospice at any time. But do keep an open mind about receiving palliative care. So if you'd like to know more about palliative care, you can go to the website getpalliativecare.org, and you can also go to caringinfo.org. Caring Info has information about palliative care and about hospice care. So those are great places to go to find resources and learn more than I've been able to explain to you here in this podcast about palliative care and hospice. But I do hope that you'll follow my advice, investigate your community, find out, do you have palliative care available? You're more likely to have a hospice in your community, but investigate that too. Find out what's there and what's available. Is there an inpatient hospice? Is it only outpatient? Do you have palliative care, and how would one receive it, or what hospital makes it available, so that you are informed for the future? I would say palliative care is definitely something that you want to be able to take advantage of if you ever need that for yourself or for a loved one. So find out if it's there for you. And hospice as well is something that might become necessary in the future too. So do your homework, find out what's there in your community, and take advantage of what's available for you and for your loved ones. So thanks for joining me today for this solo episode. Tune in next Monday. I'll be back with an interview, so be sure and join me then. If you enjoy this content, please share it with someone else you know who might benefit from it. And also leave a review if you can on iTunes or Stitcher, Spotify, wherever you happen to be listening to the podcast. It's helpful to make sure our podcast gets ranked and then is shown to more people who are looking for this kind of content. So thanks once again for being here with me. Until next week, remember, we are here for love. So face your fear, be ready for whatever life throws your way, and love each and every moment of your precious life. Bye-bye.